Assalamu alaikum, the communication day. We have Mrs. Uh, Hiba Ali, 20 years old woman, and her son, Mr. Hazem Ali, he's 42 years. You are the doctor in the medical ward, and the problem explaining the delirium to the patient relative. Patient was admitted 3 days ago with pneumonia. She started on IV antibiotics. She was previously living alone independently and doesn't drink alcohol. Yesterday, she started to become confused, agitated, and very aggressive. She is refusing to take her drugs and not eating. She is also convinced that she is taking poisons. She became physically aggressive with doctors and nurses. The symptoms are consistent with diagnosis of delirium. Your task to explain the diagnosis of delirium to the patient's son and discuss her further management. Okay, start in seconds. Okay, you can start.
Okay. Hello.
Hello.
My name is Dr. Mahmoud, one of the doctor here in the ward. Are you the son of Mrs. Hiba Ali? 80 years.
Yes, I am.
Yes, and your name is Hazem, right?
Yes, I am.
Okay, hi Hazem. I'm here today to talk about your mother condition. Is that okay with you and address all your concern?
Sure.
First, let me first ask you, how much do you know about your mother condition in order to be on the same page?
Yes, doctor. My mother, strong fighter. She's living alone and she was fine. She can do everything by herself. Recently, the last week, she complained of a fever and some cough, for which I brought her to your hospital. And I don't know what happened now, doctor, with her. She became change and misbehaving. I don't know what happened to her, doctor.
Yes, I really appreciate your concern. And so that's why I'm here to talk to you about your mother condition. You are right, your mother, when she came to the hospital, we started to treat her for chest infection. In fact, she was having a bug in her chest, so we started for her antibiotics through her veins. So she started with us to become more confused and started to be agitated. You are right about that. But because she has this infection in her chest, that's why she's behaving like that. We started to keep her calm, and also she has back-to-back nurse with her in order to be with her all the time and keep a close eye on her.
Okay.
Yes.
And will this will continue forever, doctor, or for a long time?
Yes, this is a valid question. Yes, you are usually because this patient, most of the patient as your mother, when they have this some infection in their body or bugs in their body, they start to have this behavior and this confusion that affect them behavior. But with time, when she start to respond to the medication and also start to clear the bug from her body, she will start to regain her normal level of consciousness and she will be normal, but it can take some days. And some people can have some this change in the level of conscious. It can continue with them for more than 1 week, but we'll keep a close eye and we'll update you day by day regarding her condition, but mostly it will resolve in most cases.
Okay, doc. Thank you for reassuring, doctor. But I want to know, doctor, what we will do with her.
Yes, as I told you, because now she started to be agitated and she started to refuse the medication. So we keep with her, one nurse will be with her all the time, the back. We'll try to give her the medication. And if she will try to remove the line that we are giving from her, the medication, we might put in her hand some mitens, which as gloves, to prevent her to remove the line for the antibiotic. We'll try to give her also some medication We'll ask our team in brain team and neurology team. They will come to have assess your mother condition. They might give her some medication to calm her. And till she, and also we'll do for her daily blood to check her infection is resolved or not. How does that sound?
Yes, doctor. I agree about what you mentioned already.
Yes.
But I'm worried, doctor. She was living alone, and I'm worried. Does she need to be in a hospital for a long time, or she can be at home soon?
I really appreciate your concern. I can see that you are caring and worrying about your mother, and you have the right about all this concern. But what we will do, as I told you, her condition he might mostly will improve. We need to assess her and to see when the infection will be resolved. We'll see how she will be more dependent or not, as because you're saying that she was dependent before being admitting. We'll see if she will be more dependent or not, and if she will not be dependent, we can arrange a package of care so to help her at home with her daily activity. And also we'll ask the occupational health team, they can make the home safe for her. So all of this will update you about that, and we will discuss it with the consultant and the occupational service team that they can help you with that. So we will try to keep a close eye on your mother now, try to resolve the infection, and she will regain her level of conscience, and she will start to behave as normal. And then if she need any help at home after discharge, we will arrange a package of care for her. How does it?
Okay, doctor. Yeah, doctor. Yes, all are clear so far. But will you give her some medication for this?
Usually we will try, because we know that the cause of this behavior is due to the infection that she has. So we'll try as much as we can to give her the medication, keep the nurse with her all the time. Sometimes if she started to become more agitated, we can give her some medication only to calm her down, um, till she will till the infection will be resolved.
Okay, doctor.
Okay.
That sounds good for me.
Yes, just want to ask you, you told me that your mother was completely independent before coming to the
Yeah.
hospital, is that right?
Mm-hmm.
So, and she was able to do all her daily activity, go to the shopping, do everything.
Sometimes, doctor, I take care of these things. I can do shopping for her, and I always give her the things she needs in her life.
Yes.
Anyway, she can take care of herself at home. She can cook. Yeah, she can help herself at home.
Okay. Hopefully, as I told you, most probably the cause of her behavior is due to infection, but also we are doing other investigation to check for other cause, and we ask the brain team and the nerve team will come to have a look at her to assess her, and we'll keep you updated. Okay. And
Okay.
if you also need help with your mother, we will also, as I told you, we'll arrange for her more help when she will go home. Okay.
Okay, doctor. Doctor, will be fine? I mean, for the power, the movement, she can move again as before, or the things might be affected.
Most this is a question is difficult to answer now, but most of the patients that they have this type of behavior after having the infection, it will resolve, but it can differ from one person to person. Some people will have this resolve of the symptoms of this behavior completely, and some people may continue with them for a few weeks. But
2 minutes left.
if this what will happen, we will help her. We'll include the multiple doctor to help her if she has any issues regarding her weakness or movement. We'll help her with the physiotherapist to
Okay.
to to regain all her independence.
Okay.
Okay, and
Okay, doctor.
do you have any other question for me?
No, doctor.
Okay, okay. So let me summarize what we talked through today. Your mother was admitted with infection in her, with the bug infection in her chest. So we started for her to give her antibiotics through her veins. And she started to her behavior started to be changed, and she started to be agitated and confused. So we do for her all the tests to check if it's a cause of this is only infection, and if this the cause, it will take time. It will resolve, and we will update you regarding her condition on daily basis. Okay.
Okay, doctor. I appreciate that.
Okay.
And thanks for your time, doctor.
You're welcome. Okay. Thank
30 seconds remains. What you want to do more?
you. No, I don't want to do anything.
Why you don't want to provide or to hand him some leaflet brochure about his mother condition?
Okay.
Yeah.
I can give you some leaflet to read more about this condition. It's called delirium. So
Mm-hmm.
you can have a proper read about it. And if you have any question, you can anytime you can call us, and then
Yeah.
we'll address your concern and answer your question.
Yes, sir. The time is up.
Okay.
Yeah, let me comment. Yes, you did great. Let me start from the beginning as introduction and the introduction question, what do you know? And the expectation. Always ask for the expectation because I might give you a hint or I can give you something you can correct it. For example, I
Yes.
will tell you, yeah, she has just, for example, maybe she has uh, depression, and you can correct me. No, it's not a depression. It's another condition called, for example, like blah blah blah, and
Mm,
like this. So you can also take time for the introduction and for these questions. This is
mm,
regarding to the introduction. Some jargons you went through,
yes.
you said, yeah, neurology, yeah, but with time you will improve it. And yes, the word of as I told you, try to avoid it. You can say as we mentioned or as we have discussed or something like that. Okay.
Mm,
Uh, yeah, it's little bit irritating word like I told you and you are not understanding. This is the meaning behind it. So the best way is to say as we mentioned or as we have been discussed earlier.
uh,
Okay, not pointing to him. As I told you, like you
yes.
don't understand what. Yeah.
Yes.
Yeah, you kept asking for following this, which is good. You have understand and you are following me. And I advise whenever I said something, you can start from the end of my talk. Like I said, yeah, she came with fever, but you did it in good way. She came with fever and short of breath or cough. Yes, you can ask me for the expectation, and after that you can tell me yes, she had a condition in which she had bug in her chest, and the bug make the condition worse in the form of what's called delirium. I guess you didn't say delirium.
At the end, I said, and
Yes,
yes,
yes. When
yes,
when you offer me the
yes,
leaflet brochure, okay,
yes,
what she had,
yes, you
and
are right.
the task is talk about delirium. You have to say this is called delirium, and
Yes,
the delirium is
yes, you are right.
medical term for medical condition in which the elderly patient has some variety in the brain response whenever they have something trigger it like infection, the maybe a decrease oral or decrease intake of the food
Mm,
or even fever and the infection, as you said, bug even in the chest or sometimes even in the waterwork system or in the waterwork. This is the most common cause of delirium in elder, UTI or any infection and dehydration or sometimes some fever or the patient living alone. Even this can consider as risk factor. Dissociation from the life or from the environment, especially if the patient admitted to ICU or in single room. And for the management, as you said, we can put here or if needed, if she's going to harm herself, we can put her under restraint, which is called mittens. It's a soft restraint in order to prevent harming herself. Yes, if she needs some medication, yes, I am going to give her some medication after asking help from the brain doctor or from the elderly doctor, because this is neuropsychiatrist or neuropsychiatric issue. So the best way is to say the brain or the mood or the or the elderly doctor who are responsible for such condition, if needed, of course. And something is very important here to provide her private tools at home to be in her room in the hospital, like her watch or uh, TV or the something she is used to use it at home to feel, let her feel herself at home, not in a hospital. This is one of the possible ways to manage the delirium. Along with some family member can come and visit her from time to time, or even sometimes if she need to be accompanied the patient or sit with her to take care of her. Plus, as I said, the nurse, the bedside nurse, taking care of that, and she's always helping her whenever she needs or whatever she needs. And then the other concern, you answer it and address it well. At the end, you had 2 minutes, so you can ask for the concern. If no concern, as you said, you can either summarize or you can, if the patient, you feel the patient is little bit in cooperative or not understanding, you can ask him for recap. But in this scenario, he can understand everything. So anyway, you can either summarize or you can ask him to recap. However, anytime you have gap at the end, 30 second, 20 second, offer, remember this issue. It's very important for the care and follow up. We will provide you with leaflet, brochure, website, video, YouTube, especially for the procedure, to read more about your condition or your mother condition or about the procedure or about the medication, about the disease, anything of this, it will help him to know or to be aware more about this thing. And you can follow the scenario by giving the hospital contact number or the clinic or the department or any contact number, but not your phone number, private number, in order to have uh, follow up with him in case she has any deterioration or any inquiry. This is the case scenario, and you did it in general well. Just try to avoid the jargon and the things I corrected you. Okay,
Thank you.
thank you, Dr. Salah. You can post the case for me. Dr. Ahmed Ali wrote, keep one nurse, it's not logic because there is 3 shifts, but
No,
at least,
no, we are dealing here with this case, so when any patient will be agitated, they're not specially nurse. We keep with them someone next to the bed.
yes, observer or watcher, yes.
Yes.
That's why I told you one of the suggestions to as a doctor, you can provide or you can ask for someone who can take care of her in this period in the hospital. Why? Because it will be more familiar with the patient than the nurse. So you can offer me, for example, anyone can come and take care of her. I know
No,
she was living alone. Yes, she was living alone. But in this situation, her son might come and sit with her. This is not home.
yes.
This is
So I think yes, you are right. It's better to tell him if you are with her. Maybe she's also, if you come to visit her
yeah.
more frequency, she will be happy
Yes,
and
exactly.
feel affected.
Yes.
Yes, I think this okay. This is
Yes, okay. Well area, yes, well idea. Thank you, Dr. Ahmed. But again, if no nurse, there should be in some
no.
observed area. No, it's not a, yes, I agree with Dr. Sarah. He should be monitored and he should be observed by someone.
We,
Why?
we
Because
might not
he
say no.
might,
We can say one of our team will be with her back to back. This we
yes,
we, we
yeah,
say it here
exactly.
1-to-1. When the patient is
Yes,
like this, we say this patient have one-to-one. It mean one-to-one care. Yani he's sitting with him
I
24
yes,
hours. So many
yes,
patients have diabetes and have delirium in the ward and wandering in the ward. So usually when this patient started to be agitated, one security sometimes they put one of the security to sit next to him. When start to wander in the ward, he accompany him. Don't let him go outside the ward. So there will be one next to his bed, walking with him everywhere till the delirium will be subsided. Because we are seeing a lot of
yes.
cases like this.
I
It's
agree with
I
you, Dr.
it
Sarah.
he's right. Maybe he's saying that not nurse. Maybe I'm wrong about nurse. Yes, it's not nurse. We can say one of our team. We won't say security, but usually it is a security man coming to sit one to him. So we can say one of our team will be seated with her 24-hour one.
Yeah, even sometimes patients need to be in ICU
Yes.
for medication just to control this. Sometimes we are giving some medication to control the agitation. Yes, it's one of the indication if the patient is severely agitated, and some patients, elderly especially, whenever they have this kind and this level of agitation, we consider intubation if he's too much aggressive and harming himself. So yes, it's good idea to observe him. He might hurt himself or he might harm himself by removing cannula, falling from the bed, and it will be against you.
Yes.
Yes. Okay. One concern should be about feeding. Yes, it could be there, but it's not necessary to be. I should be the one raised it as a surrogate. What if he needs some feeding? So what's your answer, Dr. if I ask how he will take his food?
So we'll tell him, we'll give him fluid through his vein. We'll try to give him fluid slowly, and we may ask the SOL team to come to see him if he's safe to swallow.
Excellent.
So we will give him.
Yes, so this is the perfect way to answer. It's calling the soul team,
Yes, yes.
swallowing and
Speech
speech, sorry, speech and
and language.
language
Yes,
therapy. Yes, and language therapy team. He will assess if he could do swallow or not. If he could, okay, he can take by his mouth. If he couldn't, we can either insert a tube through his nose or to give him some fluid through his blood channel.
yes.
Okay. Uh, Dr. Rhoda wrote good summary about the case. I will read it quickly. Introduction, including name of the patient, I guess. Delirium is sudden confusion caused by change in the brain function triggered by infection dehydration medication. In case of your mother, she is more susceptible because she is more than 65 and has infection. It's still including agitation, sleepy, seeing things most resolve in few days, while other may continue to weeks or months. I guess weeks only. Months will be dementia, defined as dementia. The medication, multidisciplinary team, yes, treat the infection, antibiotics. Antibug, Dr. Sarah, not antibiotics. You can say antibug, okay? This is one of the jargon. Antibug.
No,
With
but
hydration.
here is we say antibiotics, and
Again, the same concept.
here it's
Okay,
not
UK.
jargon. Yes. So
Okay,
if I
again,
say antibug, it will be a jargon.
no, it's not like that. But again, be simple as much as you can. Okay,
And also for the mood doctor, we can say the mental health doctor. This is not a jargon.
okay, mental health, but mood. Uh, okay, it can be yes.
Yes. Okay.
Okay, apply one to nurse to take care of her, reassure her all the time, and tell her where is she, and so on. Will make sure to be away from any pressure source and keep natural light through windows. Family member with her, even social with, and she lives any support, leave it. Excellent. Thank you, Dr. Roda, for the summary. A good idea about the timing. Patient should know what the timing. So you can keep the windows open. This is one of the good ideas to be applied here to know about the day and the night time. If the patient aware about or are oriented about the timing, he will be prevented or something you can say prophylactic. But if the patient doesn't know the time, he will be more susceptible to have this delirium. I mean, if he's continuous dark room, He doesn't know where is he, when is he. It will be like this risk factor for delirium. Suggested point, and I don't know. Yes, Dr. Roda again. I don't need to ask advanced directive. No, 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 no need at all. It may continue for months, especially if it. By the way, again, the condition continued for months is dementia. Delirium, it's supposed to be maximum weeks. Once the trigger or the risk factor subsided or improved, the delirium will be improved. But if the patient already diagnosed as dementia means he came with chronic condition called dementia. The patient has mental change or cognitive dysfunction since before. And this risk factor for delirium will be more, and it might be worse. I mean that the dementia will be worse. You can ask in this situation if the patient admitted after dementia and he came with decrease of consciousness, he might be more deteriorated, and yes, he might go in coma according to the diagnosis, maybe meningitis or whatever the case. For medication to calm hair, yes, down, I guess can be prescribed. I mean, internal medicine, not necessarily psychiatrist or geriatric. I guess internal medicine doesn't know more about this medication. However, according to the hospital policy, better to say the specialist team or specialized team concerned to the elderly, better than saying the internal medicine, because I mean maybe this is not the policy in the hospital. Okay. Yes, timing is something important. Anyone has comment before starting the second scenario? Uh, okay, you are the cardiology senior house officer working in the busy CCU, cardiac care unit. Please read the scenario below. You may make notes. Paper provided. Yes, when the bell sound. Okay, enter the station. Okay. Subject, Miss Dr. Amanda Walters, house officer. Dr. Walters has been working on your house office, and for the past 3 months, she previously worked as ENT house officer and had a great time, but is really finding it tough in her current post, even though she has aspirations of becoming a cardiologist. She has asked to meet up with you to discuss her difficulties. During the discussion, she tells you that she feels that she is being bullied by the registrar who belittle her at every opportunity and on occasions has made remarks in public that she found extremely offensive. He had joked with the nursing staff that it wasn't too late for her to become a nurse, as the patient would always assume that she was a nurse anyway. On another occasion, he had suggested that she should try wearing shorter skirts if she wanted to get ahead. The consultant she works for is very approachable, but is rarely on the CCU. Moreover, he is very friendly with her registrar and Dr. Walters. And the Dr. Walters is concerned that complaining may have negative repercussions for her careers. Hence, she has chosen to consult you for advice. Your task is to listen to her concern and give her appropriate advice. Okay, give
This is
me,
scenario,
sorry,
a long scenario.
no problem. We have to train on such kind of scenario because in the exam they are giving us long scenario, and you
Mm.
can read it many times while you are in the stress. You can't collect all the ideas, so we have to train how to collect ideas from long scenarios in short time.
Mm.
Okay, give me 1 minute or maybe less. I just
Okay.
recall the name. Okay, let's start.
Okay, you can make the timer.
Yes, I'm checking the age, but no age written here. No problem.
Mhm. We are friends, colleagues.
Yes, yeah. Okay, hello there. I am Dr. Mukhtar, the doctor in the unit today.
Hi, hi,
And
yes, hi, Mukhtar. I know you
yes,
don't know if you know.
yes, yeah, I know, yeah, I know you. And I'm here to talk with you about your issues. Is that
Yeah,
okay for you?
yes, thank you so much. Do you have work now?
No, it's yeah, it's my duty. Yes, I'm on duty, and I'm here to sit with you and to listen. What's
So you
happened
don't,
with you?
yes, you don't have any urgent patient or something urgent that you need to do right now, right?
Yeah, everything is settled, and I just came when they called me that I have to sit with you,
Okay,
and they told me you are worried. Can I know what happened exactly?
okay, can we go to the doctor office? No one there, so we can have it, because I want to discuss with you some issues. It's only not for the patient, it's for me, but let's go to the doctor office.
Yeah, be sure that we'll sit in a confidential area, and no one will be with us, and it will be confidential between me and you.
Okay, thank you so much, Mukhtar. So, you know that I started working here 3 months ago.
Mhm.
And since I started, I'm happy to work in the cardiology unit, and I'm starting to think to go for this way for the my specialty training. But the issues in this ward that I'm struggling, I found some difficulty here. Before I was working in the ENT ward, and I was happy, and all people was happy from me, and I didn't face these difficulties that I'm facing here. So I don't know to who to talk. So that's why I'm coming to you, Mukhtar, to talk to you about what's happening, because I don't know who can lead me here in the wood.
Yeah, okay. Yeah, I appreciate that, and I am be sure that I'm here to help you. And I appreciate also sharing this with me. Just before we can move on, can you confirm your age, please, for me? How old are you?
Yes, I'm 25 years old.
Okay.
Mm.
And how do you feel now? Are you okay?
Yes, I'm good, but I just want to tell you that I'm not feeling comfortable in the wood, because I see,
Yeah.
our registrar. Um, he's thought. I think that I'm facing bullying from him. And every time he's making remark for me in front of the patient, tried to say, one patient one time said that you are the nurse, so he said it's you can be a nurse, it's not too late to be a nurse, and he was talking while laughing. So I'm not happy with that, and I don't know how to deal with that.
Yeah, I appreciate again what you are sharing with me. And as I mentioned, or as we mentioned, that we are here to help you and to support you. Don't worry about that. And I can be sorry for what happened with you. And sometimes the miscommunication between colleagues might lead to such an misunderstanding.
No,
So
it's not miscommunication. This came at the beginning. I was thinking this miscommunication, or this is because I'm new. But this has been repeated many times. And the other things, he started one day telling me, if you wear short skirts, you will have a good, you'll be a good cardiologist. So I think all of this is inappropriate, and I don't know how to deal. If I will tell the consultant if this can affect me in my career, so I'm really feeling desperate, and I don't know how to deal with all of that.
yes, again, I appreciate what you are sharing with me. And I am so sorry again about what you went through. And let me tell you that it's good opportunity to have you in our department and in our unit. You are precious for us, and we are here to support you, as mentioned before. And we are here
طب
dealing
ليه يا
together
فندم؟
as colleagues.
ما هي
So
انت دخلت واحد كنت الدايره ما في
I'm
تعب مش عارف
I'm so sorry about what happened between you and my friend, my colleague in the unit. And let me try to solve this problem if you don't mind.
Yes, how you will solve it. That's why I think that's the only one that I want to discuss with you. So tell me how you will able to help me.
Yeah, yeah. So since this is confidential and it's related to you, I have to have a talk with our colleague, and if you are agree for that, we can arrange a meeting with him, and also I will be attendant there. How do you feel about that?
Okay, but I'm afraid that this will affect my career in the hospital, and also it will affect my work. They might write for something wrong about me, and that can be reported to the GMC, and this may affect my report and my annual appraisal.
I again appreciate your worry, Dr. Walters. So it's not the matter here. We are here working as a team, and all of this is the teamwork behavior. Always we have to be together, not to be against, and we are not using to have this misunderstanding between each others or between us. So let's fix this problem. If you don't mind, I will have a meeting, as mentioned earlier, with our colleague. It will be much helpful for both of you, just to make everything clear from your side and from him side, or from
Oh,
his side.
okay. Can you talk to him without saying my name? It could be anonymous, because I'm afraid also to disclose this.
Okay, means I appreciate again this is this issue, but once I can talk to him about this issue, he might know it's related to you. I'm not sure if he can understand that without mentioning your name or make it as anonymous. However, I will try to talk with him, uh, of course, after your approval, and I
Okay,
will try to make it as anonymous.
okay,
Is that okay?
okay. Yes, that's
Okay.
fine.
Yeah. Okay. You have any other concern or you have any other problem in the department
No, no.
or in the unit?
People are kind with me, and I'm enjoying work here in the cardiology ward. So I'm happy with working with the team.
Okay. Can I ask you some questions, Dr.
Yes,
Walter?
yes.
Do you have any social problem apart from the area you work in?
No,
Any family issue?
no, no,
Any financial support issue?
no, no, no. I'm very well. Nothing. Only these things that I don't know who to talk. That's why I think maybe I will have you give me some advice and help me with that.
Okay, I appreciate all this, and please let me know if you need any help or any support regarding the work here or something related to our unit, and I will be ready to hear you again and again if you have any problem.
Okay.
Is that okay for you?
Yes. Okay.
Okay. Uh, Anything else ongoing can I know about this issue in the department, in the unit?
No, only as I told you, this is this three situations that I explained to you that happened, and I think this is not appropriate behavior. At the
Mhm.
beginning, I was thinking that it's maybe this misunderstanding, but at the end, I started to know that there's something wrong, and I'm facing some bullying in the department
Okay,
register.
okay, okay. Thank you for your time, Dr. Walters. Again, I will have a meeting with our colleague and I will try to explore the things more as an anonymous. And I will not mention your name and be sure this will be confidential between me and you. Whenever the things will be out of that, I will inform you before breaking the confidentiality. Is that
Okay,
okay for you?
thank you so much. That's really helpful. Thank you so much.
You have any other concern?
No, thank you.
Okay, I can. Yeah, you know that the unit, if you want to leave today, I know you are passing through difficult times. We can make one day for you like sick leave just to take a rest and to relax at home.
Okay, thank you.
Okay. Do you need any other support or any help?
No, thank you so much.
Okay. Here you are the number of the department and our teams, and whenever you have any query, you can call us.
Okay, thank you so much, Mukhtar. That's really helpful.
Okay, time is up. I
Yes.
don't know what to say, but
Okay. So
I created from
okay, I think this scenario, maybe you are not familiar with this scenario.
yes,
It can come, this is a colleague problem. Okay.
colleague problem. Yes.
Yes. So usually when you are talking with your colleague, you are not saying doctor. Even the colleague is a consultant, you will call him by his name. So
Mm-hmm.
So, and you don't need to confirm my age or anything like this. So, what the scenario? Any colleague, you might have a scenario that the colleague is drunk and came to the ward. So there is a lot of scenario, and one colleague that has a needle prick. So all these scenarios. So what you will do if the scenario is saying at the beginning that the colleague want to talk to you. So at the beginning, how are you, and say his name without any doctor, because you know
Mm-hmm.
is your colleague. You see him every day. No need to
Mm-hmm.
confirm the age, and then ask him. I know, I see you told me that you want to talk with me. So, and
Mm-hmm.
tell him also, are you free now? Do you have any urgent patient with you now? Because you make sure
Mm-hmm.
that you are safe doctor and he's safe doctor. So you can say,
Mm-hmm.
this is the appropriate time. You don't have any urgent patient or any job. You should do it now. If he say no, okay, so let's go to let's to go to have a coffee, or let's go to the doctor office, or to talk to talk to have a proper talk. Okay, and then he will tell you the problem. So for this, in this scenario, this patient, this doctor, she facing bullying from the registrar, and this can happen. You did right, but at the beginning you say that it could be
Mm-hmm.
misunderstanding. Are you confident that this is a bullying? So I see. So I will tell you no. Yes, I'm very sure, because this is not only one time, not misunderstanding. This happened many times, and then I will say the three situations that happened. So
Mm-hmm.
so you will say you don't need to, because this also the other one is your colleague. So you won't say anything. You said I don't know what's happening, and I'm not quite sure. But if this is the case, bullying is not tolerated in the NHS, and also according to the GMC regulation, or the regulation, or the country regulation, it's not harassment or bullying is not tolerated and not acceptable. So what do you think we can help you with that? So I will tell you, maybe we can say to the consultant, because but the consultant is his friend, and I'm afraid that he will maybe with
Protect him.
yes. And so you will tell her,
Mm.
so I can help if you want me. I can if you want me, I can. I think we are here all working as a team. So I think you can go to the consultant and explain for him the situation. And then if she told you no, I don't want to, I'm afraid that this will affect me and affect my career. So you can say for her. So she will tell you, or you can offer anyone. You can be anonymous. We can also try to make this complaint as anonymous without saying your name, if you are happy with that. So she might say she might say, okay, I don't want to say my name. You can make it anonymous. Say to the consultant. And then okay, and then in some of the case, any doctors, he has medical protection. So a medical protection agency, because any doctor, if he has trouble here, he might ask the medical protection advice. They are paying every year as يعني زي محامي كده. Okay, so as solicitor. Okay, so because if any doctor has a mistake, they might have a
Yeah. To
so
intervene.
you can say to her, what do you think you can ask when she's saying this will affect my career, and if it has been disclosed that he's doing this, they might affect my career. So you can tell her, what do you think you can ask for advice from your medical protection agency. Okay, so she can have other opinion from the medical protection agency for this case. And then okay, this is the case. So you are not with your colleague at the beginning. You say it could be
Yeah.
misunderstanding, and then at the end, if it's this case, is this So this is not acceptable. I'm really feeling, I'm sorry about how you're feeling now. So what do you think we can move things forward? You want me to talk to him or to escalate it to the consultant? Because she will say, she need to say no, you can talk to him, or she can have the choice of to talk to him directly or to escalate it to the consultant. Okay. So, and you'll tell her, we are here. I don't want you to worry about that. We are here working as a team. And I think the consultant will take it. We'll consider it, and we won't take it seriously. We are here to support you. And you can ask her, what about your mood? Because she's saying, I'm not happy. You didn't ask about her mood at all. So what do you think? She said, no, I'm in bad mood. So what do you think? You can ask the GP to refer you to the mood doctor. This can help you also to cope. And also we have the GP can refer you to the social teams that they can help you to let you learn how to deal and cope with such situation in bullying and harassment. So
Yes,
this
you're right.
is important also to offer to your colleague, because this doctor is suffering from bullying for 3 months. So how is this affecting? I think this will be affect her confidence, will affect her moods. So I think the only issues in this situation is that you will tell her everything is confidential, as you did
Mhm.
it at the beginning. As it is your condition, so everything is confidential. I won't disclose anything, only with your permission. You won't be on both sides. You will be in between. And if it's the case is bullying, so you will tell her and give her the choice. What do you think? Usually with the colleague, better to keep her the choice. What do you think, even for the drunk one? What do you think we can move things forward? So she will tell you, I want to say to the consultant, but I'm afraid. So you will tell her, we are here in the hospital working as a team, helping each other, improving each other. And when she's saying this will affect my appraisal, this is affect my work and career. So you can tell her, I believe this is unlikely to affect it, but what do you think? You can have advice from your medical protection agency. They can advise you with that. So,
Yes, yes.
so this is the scenario. So in any case of colleague, it's not as a patient, a colleague. So first you will talk to him with the name, take him and tell him, let's go to a quiet room. You can not private. You can say, let's go to a quiet room. Offer, we can say, let's have a coffee together and discuss what happening, and ensure confidentiality. And if the patient is drunken or anything, ask about issues, and all the time say, we are here colleagues, we are here to support each other, we are here to help each other. So this is, I think, the case of such. There is a lot of scenario from this issue. So I think this is how we will make it as a scheme.
Yeah, yeah, I agree now for this thing. So
Yes.
I can offer as authority. I don't know what the name, if like for example, medical protection or whatever the name, but
Yes.
yeah, I can mention some of the authority who can help you in this regard regarding to the annual appraisal.
Yes, and the other thing, because one scenario, the patient, your colleague did a mistake, so he's
And yeah,
our
to
near.
cover.
So
Yes.
this near mistake, it will affect her appraisal or affect her career. So you can say, you can have advice from your medical protection agency. It's
Mhm.
agencies that they are paying money every year to help them if they have any trouble, as insurance,
Yes.
because we don't
Like
have.
insurance.
Yeah,
Yes.
because if you get this trouble and you don't have insurance, you need to pay a lot of money to have a solicitor or have muhami
Yes.
for your
Lawyer.
solve any
Yes.
problem. And also they are giving advice on bullying or any problem at work, so they are helping with that. So you can offer this at any patient of this.
Yes. Good idea. And good scenario as idea because it's very uh, different scenario from others we are practicing daily.
Yes.
But at least if we face it in the exam, you know how to drive this scenario because it's a new one. Yes, I believe it. If it came in exam or if it come in exam, it will be very challenging one, and you might be also in stress how to manage this scenario. Thank you, Dr. Sarah, for this scenario and for your advices. Anyone has comment or question related to this scenario? As Dr. Sarah said, this scenario comes like either misunderstanding or needle stick or a hepatitis B we did a scenario with the hepatitis B positive result, how to manage and how to deal. This scenario is different little bit, but it might come. They are doing different things now, and they are doing weird, and they are bringing weird scenarios. They might bring like this. Anyway, we have to know how to deal with your colleague if he has an issue in the work, or medical issue, or ethical issue with his colleague, or whatever the situation. Okay, any question or any comment? It's clear so far, this scenario, how to manage and how to deal with. From all other colleagues, please share with us any opinion to be added. Okay, let's go to the next couple, Dr. Abdullah and Dr. Mahmoud.
With you, Dr. Basim.
Okay, Dr. Abdullah there? I guess he didn't attend.
Yeah, Dr. Basim.
Okay, with another name. Okay, so you prepare a scenario for Dr. Mahmoud?
Yes, Dr. Basim.
Okay, who will start first? Just arrange together who will start and post the scenario down, please.
Ask you a question, Dr. Basim, regarding what is mean by clinical judgment in the exam?
Clinical judgment?
Yes, there is one category, clinical judgment, differential clinical judgment.
Yes, differential diagnosis is known as differential diagnosis. Clinical judgment is a discussion between you and the examiner for anything. This is the clinical judgment. And between you and the patient or the surrogate, if he asks you for something medical. For example, if the concern for any rheumatoid arthritis, what I can take, doctor? So your answer should be, or how to manage me, doctor? Your answer should be logic and scientific way, and you have to satisfy her concern. What you should do with me, for example, if she asks for admission, you have to say admission. This is one of the clinical judgment. I will admit you. So this is correct, and it will be as clinical judgment correct. If you said group of doctors, this is also one of the management plan, and you should do it. So this is also clinical judgment. This is the meaning of the word clinical judgment. The differential will be differential with the examiner, not with the patient.
Yes.
Any other point with the patient or surrogate will be as clinical communication, like taking history, like asking for things in the history, like social history, like occupational history, all this under the term of clinical communication skill. I'm talking about skills now. Okay.
Thank you.
Most welcome, Dr. Okay, Dr. Ahmed, Dr. Abdullah, did you write the scenario, or Dr. Mahmoud write the scenario for Dr. Abdullah? Anyone who will start?
On the chat box, Dr. Basim. Chat box.
Okay.
Oh,
Both
Dr.
of you
Abdullah.
share.
Both of
Together,
them.
Dr. Abdullah. So let's
Okay.
start. Yeah, Dr.
Okay.
Mahmoud shared first, I think.
Okay, I will start scenario, Dr. I will
Yes,
start.
as a candidate.
Okay, I will
Sorry,
start.
sorry, you will start as surrogate or candidate?
As surrogate.
Surrogate.
No,
Yes.
as candidate. As candidate,
As
sorry.
candidate, so let's
Yes.
read Dr. Abdullah scenario. Dr. Abdullah scenario.
Okay.
A patient named Miss Amina Al-Batashi, 75 years, female, patient relative Miss Samah, her daughter. Your role is medical doctor in the medical ward. Miss Amina is known to have osteoporosis on the alendronate treatment. She was recently admitted with chest infection. While in the ward, she started to complain of gastric pain. The treating team noted a mild drop in her hemoglobin level, so alendronate was withheld, and they arranged for endoscopy. Endoscopy reported mild grade gastritis. CT scan showed compression fracture at T4 and T11. The inward team initiated PPI, proton pump inhibitor treatment. Your task, explain the situation to her daughter, Miss Samah, and address any concern she may have. Good scenario. Let's give you 2 minutes, Dr. Mahmoud. Then
Okay.
also, Dr. Abdullah, you prepare yourself for the another scenario. Okay, ready, Dr. Mahmoud? Let's start.
Okay, Dr. Basim.
Yes, you can start now. Here you go. Yes, you can start.
Yes. Good night. I am Dr. Musa, doctor in the clinic today. Let me confirm you are Mrs. Amina, 75 years old.
No, doctor.
Oh, okay, sorry. Let me confirm you are Mrs. Samah, daughter of Mrs. Amina.
Yes, doctor.
Okay, I assume to take permission from Mrs. Amina. Are you have permission?
Yeah, doctor. Sure.
Okay, Mrs. Samah, we are here to discuss the recent camera test of your mother. Is it okay with you?
Yeah, doctor.
Okay, how much you know about your mother's condition?
Yeah, doctor. You know, my mom has this osteoporosis problem, and she's taking medicine regularly. And the issue why we came to hospital, she has tummy pain, and they did for her some tests, and they told me to come today to discuss the result of this test, to include scan to her backbone, and also they did for her camera test. So I came to know what to do.
Sorry, Dr. Abdullah, voice not clear.
Yes, I'm here just to know what are the results of the scan of the backbone and the camera system for the
Sorry. Okay, do you have any expectation for the result of these scans?
No, doctor, just I think maybe there is a infection or I don't know exactly.
Okay, let me explain more about the result of your out of scans of your mother. As you mentioned, your mother have a long history of thinning of the bone. She was in medication called alendronate. Then she had bug infection in her lung, and we start the antibug for treatment of these bugs. Then she had a tummy pain. And on regular blood tests, we see that one of the blood tests is decreased. So she did a camera test to her tummy, and it revealed that she has mild soreness in her stomach. So what do you think? What do you think about that? Are you with me?
Yeah, doctor, you mean that the result of the camera test is that there is soreness in
Yeah, it's soreness, and there is many causes, maybe related to the drug that she have due to thinning of the bone. Maybe she didn't take this medication in a proper way. There is some precaution. We will discuss with her the precaution during taking this drug, like drinking plenty of water. She must sit upright during taking this drug, and she must take after the food. We will discuss with her about this precaution. But let me ask you: did your mother travel recently?
No, doctor, why you ask me?
Is she had any contact with the infected person with TB, or have contact with cattle or sheep?
No, doctor,
Okay,
why?
because you know your mother have a bug infection in her chest. This drug increase the chance of activate any latent superbug of TB. So we will refer here to infectious control to make some blood tests to be sure that it is not superbug of tuberculosis. Is it okay with you?
No, doctor, but why you think she has the bug is just in her teeth? Why you think this may be related?
Yes. We will be to be sure that no present of this superbug. Okay.
Doctor, I know about TB. My mother hasn't any cough. She has no any fever for a long time. She has no sweating. I don't think that will be the right way.
Okay, it is good. It is good thing. It is good thing to hear about that. Okay. Do you have any concern till now?
Okay, doctor. And what's about the result of the scan of the back?
Okay, the result of a scan in her tummy, as I told you, the soreness in the stomach. And about the scans of the back, I'm sorry to tell you, I have some bad news for you.
What is there, doctor?
I'm sorry, they have like a fracture at the spinal cord.
Oh my God.
Yes, I am sorry for that. But be sure that we will give her full care and support. For that may be due to stopping of hair alendronate or progression of hair thinning of the bone.
Doctor, but she didn't stop her internet so
She didn't stop. Sorry, Mr. Abdul. Okay, Mrs. Samah, can you tell me with whom you are your mother living?
She's living with me.
With you?
Yes.
Okay. Okay. Till now, you have any concern?
Doctor, do you mention for me because she stops the medicine? Maybe they stop the medicine when she's now on hospital. Do you think this may be the cause during this couple of days, and they stop the medicine, and this may be the cause of having the fracture?
Yes, I appreciate your concern. But you know, alendronate is a drug, like any drug, has its own its own bad effect. One of the bad effect of its bad effect, it may cause soreness of the stomach. That was the cause of decrease his blood test. And there is now, you know, it is red alert to stop this medication. And as I told to you, this fracture may be the normal progression of hair long-standing disease, thinning of the bone, or maybe due stopping this drug, which is alendronate. You know, it is an urgent situation now. It is dropping of hair hemoglobin level, outweighing the risk versus the benefit. The risk of this drug is high, so we had to stop this drug already.
Yeah, is this my
2
concern?
minutes left.
Why
Yes.
do you stop medicine? Maybe because why she's at home, she didn't stop alendronate. But I think it stopped for the last couple of days. So maybe this is the direct cause to have fracture.
Yes, you're right. We stopped it already since a couple of days. Okay.
Okay, and now what you are going to do for?
Okay, now your mother in the medical world, we are going to do make multidisciplinary team of bone doctor.
Sorry?
What?
What you are going to do for?
To make multidisciplinary team. Okay.
Okay, doctor.
Okay, multidisciplinary team of blood doctor and bone doctor to give her full care and support. Let me summarize what we have today. Your mother has long history of thinning of the bone, and then she admitted with bug infection in his lung. Then he complains of. Yes.
Let me ask you a question. You think
Okay.
that the doctor who gave her the alendronate, he make harm for her because this is the cause behind she has soreness in the. So this doctor make wrong with it. Am I right?
I can't hear anything.
Yeah, time is up, and your sound, all the scenario, Dr. Abdullah, is not clear. Please try to adjust your mic for the next scenario, okay?
Okay.
Yeah, there is
just
some
one
connection. Yes,
minute,
please.
Doctor.
Yes, I need the last concern. Sorry, Dr. Bisph.
Yes, the last concern.
What?
Yes.
Yes, last concern.
You think that the doctor wrongly give her this alendronate because it is a direct cause to have soreness in the stomach. Am I right?
I totally appreciate your concern, but alendronate is prescribed to her in the best interest of her condition. And the usual practice when we prescribe this drug, we do some investigation to rule out any disease, and also we give precaution to use this medication, like plenty of water, and take it upright. But this drug has complication and can happen. Okay.
It is one of the known side effects of this medicine.
Yes.
Yes, yeah, you know, to mention that directly like this. Okay, thank you, Dr. Mahmoud. You did it.
Thank you, Dr. Nassim. The voice is very bad.
Okay,
I'm
Yeah,
sorry.
no
yeah,
I am
there is
sorry.
no problem, no problem, Dr.
Okay,
Mahmoud. Please,
Dr.
Abdullah, before starting the comment, please adjust your connection so we can hear you well. Because your voice like on and off.
Okay, now more clear.
Okay, you can start commenting now.
Okay, Dr. Mahmoud, just regards the communication. Uh, uh, your begin your start is you use a fixed beginning, yeah, but you start to tell me about the condition before to know my background. So this delay made some delay in breaking bad news or in starting to explain the main topic. Get my point? And then after that, you have a lot of, I think more than 2 minutes. Then you told me about the diagnosis, and even you didn't mention the name of the disease. You start to explain that. So in this manner, you are right. Your mother admitted with bug infection in her chest. She has some tummy pain. Some investigation done for her. There is now really. Sorry to tell you that it is not as we hope. The camera test show she has gastritis. Do you hear about that? Then you can explain it is a soreness. And yeah, first to mention it is gastritis. And then you also to be on the same page. I didn't mention all the data. Just also to buy the time, you need to tell me, let's fill some gap. And also, I believe that your mother, like that, yeah, all the data I didn't mention, you can tell me, let's fill the gaps and tell me about the data I didn't mention. And then, because when you start to explain to me, to link all the data to then after explanation, because you have a lot of time to explain in brief the gastritis, and there is a lot of causes behind it, and one of it may be directly related to the medicine, not the medicine that he used, alendronate, and it is one of the known side effects of alendronate. And then I don't know why you asked about bug infection, Dr. Mahmoud.
Sorry, I يعني miss with yes,
Misinterpretation for the data.
yes, there is another drug, please, in the latent
I get it.
TB. What is the name? I can't remember.
Methotrexate.
Okay.
Yes, Dr. Bass.
Or infliximab oil. Okay.
I'm sorry. I'm sorry about that.
Yeah. By the way, you didn't to mention anything not mentioned in your task or in your scenario. Even this bug infection is a side effect of this medicine. It's not mentioned in the scenario. Okay. Oh, don't mention it by any chance. Okay. Then after that, you need to read the scenario. The plan is written in the scenario. We will hold this medicine. We will start her on a medicine that help in heal of this soreness of the stomach. Don't worry about that. This is the plan which is mentioned in the scenario. And then we will jump for the another task. Also, I'm sorry to tell you that the scan of the bone showed she has fracture in her in the region, مثلا, of the chest, and this broken of the bone may also, there is a lot of causes. One of maybe directly the progression of the disease itself. And also that my concern, stopping of medicine is just for a couple of days. It is mostly it is not the cause behind. It is, as you mentioned, it is progression of the disease. The other thing, this in the communication, also in judgment, Dr. Mahmoud, in judgment and concern, both of them. Sometimes you drop my concern. I ask concern. You are speaking about another concern, or you speak about your concern, not my concern. Get my point.
Because the
I
voice,
raise the
Dr.
concern.
Abdullah, really, because the voice is very bad till now. You know,
Okay,
I can't hear you.
okay,
Okay, doctor.
okay. We need
But
just to focus on my concern. To answer my, even you didn't answer in the right way, or if you haven't an answer for the concern, you need to just to respect it. Sometimes I ask you concern, you drop out and you continue to speak on your.
sorry, that is the first time to practice, you know.
Okay. No, it's
It's the
good.
first
It's a
time.
good thing that, yeah, it's the
Okay.
good thing that you are not, you didn't stop. You continue to explain more and more. This is good thing.
Yes.
This is good thing. Then you use some jargon. You mentioned
Yes.
this is the first time. Yeah,
Spinal cord.
you
Yes.
will involve spinal cord and multidisciplinarity and drugs. If you use jargon, you need to follow it with explanation briefly, or okay, you can just explain it. Multidisciplinary team, I mean a group of specialists, a group of doctors, including. Okay. Then the plan of management, as mentioned in the scenario. Okay, communication, judgment. You said you didn't hear my voice. I think in judgment, some points you need to explain more and more. You need to a lot of sympathy and empathy also to add. I'm sorry for that, and in
Yes.
social history it is good. And you ask about who support the mother, and that's it. I think nothing else can be. But thank you very much for.
Thank you, Dr.
Okay, thank you, Dr. Abdullah, for the scenario and the comment. But please, before starting the second case, try to disconnect and join back. There is still some lagging in your sound. So better to reconnect back. I just give Dr. Mahmoud some comments.
Yes, Dr.
Yeah, it will not be more than Dr. Abdullah already. He covered most of the thing, but the missing thing. So in the introduction, no need to mention good evening, good night, or you can say according to the time. So, but a good night, of course, it will not be because they are not doing exam in the night. So you can say good morning or good evening. Okay, it's not related to their practice time. It's related to the time of exam.
Okay.
They have confirmation, your name and your age, and be sure you are not mixing. Okay, don't mix the names. And the confirmation of the age for the mother, the patient, not for the surrogate. So the mother name, for example, Mrs. X, and her age is 80, and you are Mrs. Samah, and you are the next of kin. You have to confirm if she is the next of kin. Good.
Yeah.
You mentioned
Yes.
that you assume there is approval or there is acceptance from the mother to talk about her condition, but don't ask again, are you having the approval? Because you already assume it. Once you assume, no need to ask her. If she said no, I don't have approval to talk about my mother condition, what you will do?
Okay, just ask Dr. Basim, are you have permission?
No, don't ask. You assume there is permission or approval. So you assume it. No need to ask her.
I assume to permission. Just
Yeah, because you are
yes.
the one have to take permission, not her. She is the
Yes,
daughter,
yes.
and she should be the one talking to you about her mother, not you. You are assuming that you are talking to her after her mother permission. So you got it. Not the mother, not the daughter approval from the mother, because the daughter already knows about her mother.
Okay.
But to talk with the daughter about her mother, this is the permission. This is the issue. To take permission from mother to talk to her daughter.
To daughter.
Yeah, not the opposite. Not the daughter
Yes,
will take permission.
I said that, Dr. Basim. I
No,
assume
you
take
said,
permission.
are you? Yeah, I assume you take permission. Are you having the permission? Are you as daughter having permission? Why you ask her this?
You have permission from her mother.
If you ask this question, you will be in trouble if she said, no, I don't have. Because you assume that there is permission between you and the mother to talk with the son or the daughter.
Mm.
But the daughter, if you ask this question, she might say no, because you don't know if she talk with her mother or no. But you assume that you are getting the permission from the mother to talk with the daughter. This is the way how to start.
Again,
Okay?
please, Dr. Basim. Again. Sorry,
Okay,
again. Mm.
again. You assume there is permission from the mother. You got it to talk with
Yes,
the daughter. Okay?
to daughter. Yes.
Yeah. So no need to ask the daughter if she has the same permission.
Okay. Okay. Okay.
Okay? The permission from you
وصلت. Mm.
as her doctor to talk about her condition to the daughter. But the
Mhm.
daughter doesn't need this permission.
Mm. Yes. 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 I
No
got
need
it.
to ask permission from the daughter. No, you are the one getting permission from the mother. This
Mhm.
is the summary. Okay.
Okay, Dr. Basim.
Yeah, then as Dr. Abdullah said, you have to ask about what you know about your mother's condition so far and the expectation about this meeting.
Mhm.
Then, as Dr. Abdullah started and commented, yes, what she has, don't repeat what she mentioned. If she said, my mother having problem with her bone thinning and blah, blah, blah. Once she stopped, she said, yeah, and she took the medication. Okay, what's your expectation? Yes, expectation that it was infection or there is something ongoing. I don't know. Don't
Oh.
explain, yes, your mother having the thinning. No, you can say from the point she stopped. She said, and she took medication. Okay, I'm here to talk about that. And yes,
Scans.
yeah, the result of the scans, and we did some blood tests and so on. Try to make simple words, no jargons.
Okay.
And the scans shows you can give some pause, what something concerning or something we are not hope to see or to know. What, doctor, what you mean is there is something bad? Yes, I'm so sorry to say there is some side effect or unwanted effect happened from the medication she took.
Mhm.
Why? What happened? Why no one said, no one give us precaution? You can say, yeah, we used to give this precaution before starting this medication. And the precaution is, as you said, to stand or to sit upright position, to take it with plenty of water, away from food. And
Mm.
I guess, suppose your mother follow this instruction. Suppose we are giving this instruction before starting this medication. If she said,
Oh.
okay, okay. If she said, no, doctor, no one mentioned, you can say, I'm so sorry about this. And I will let you know more about this medication if you want me to explain more. Then the other finding in the CT, which is thinning or fractures of the bones. Don't say spinal cord. It's
Spinal.
bone or back of the bone of your mother back. This is the way how to explain it. And as Dr. Abdullah said, don't invent or don't make things not in the task. Why you ask for the infection? It's not the task at all. Plus,
Mhm.
don't take history. If you want to give instruction about an infection, you can tell her, yes, for example, but not in this scenario. Infection here because of something occasionally, not related to the medication. But if your condition, the patient have infection because of medication, so you can say it as advice or instruction. Whenever you are taking this medication, it can depress or make your defense system weak. So you have to avoid the sick people and not to travel to endemic area or areas with a lot of infection like that. But don't ask, did your mother travel? No. Did she get contact with sick patient? No. Don't ask this question in communication scenario. It will give bad effect in your marks. Okay.
Okay,
It's
Doctor.
considered as history taking.
Mhm.
And the concern at the end, And social support, as you said, and as you did, social and some support at home, occupational therapist. She has some fracture, and you have to take care of these things. She might fall back, and she might fall at home, at her home, or at her home on the back, and she might be complicated with a lot of fractures. Her bones are very weak. You can add to the team occupational therapist just to take care of the environment or at home. Okay, to prepare her home to be safe for her, not to have any falls. This is one of the important team here you can add, along with instruction about the gastritis precaution for the next time, how to prevent it again. Okay, but
Okay, doctor.
don't give an offer or an option which is not written. For example, don't say we will give another medication different than alendronate given by IV channel. It's one of the options, but don't offer it by yourself. As long as not written in the scenario, don't mention it. This is away from the scenario. You didn't, and Dr. Abdullah didn't give you this question, but it's supposed to happen. Someone will ask you, doctor, so what you will do now if she has this gastritis and you are giving this medication for bone? What the next option, doctor? So what you will say, according to what written in the scenario. If they told you you have to offer another medication for the bone through blood channel, like example, the same medication, but in IV form, you can mention yes, there is another medication through the blood channel, and it will be given through the blood channel. Denosumab, they mentioned denosumab, so you can say denosumab will be the alternative. If not, don't offer anything not written. I'm doing that because I anticipate this might happen with the scenario. I guess Dr. Abdullah also from the ideas in the scenario, it might be the concern what you will do now after stopping this medication. Will you live here without medication for the bone? So the option will be according to the scenario, if written like that, or group of doctor or the bone doctor will give you the suitable medication for her condition. Okay. Dr. Abdullah, ready for the next scenario? Yes, Dr. Sarah said you have to ask if you are the next of kin. Yes, you have to ask this question.
Yes, Dr. Basim, I didn't get the scenario because I
You get
leave
out. Okay.
and then come again. Yeah,
Yes, I will send
no
it back.
answer.
Dr. Abdullah, any concern for the previous scenario about the option, the alternative plan
Mm,
after stopping alendronate?
no, just when we discuss the scenario, not
Yeah,
raise concern like
not
that,
raised. Yes,
the multidisciplinary team, when the one of the concern, what is the next step that will involve the bone doctor to
yes,
give
to
the
have
plan of
another.
management. Yeah,
Yes,
yeah. When we have no data, we just give outlines. We didn't mention a specific plan of management. Just outlines will involve the bone doctor, and even if the plan of management will be like definitive plan, then also you can mention it in outlines. We will like you mentioned, maybe may or give options. Okay, there
yes,
are another options where
yeah, but not
we
clear.
can, okay, but not, yeah, not definite.
Yes, not
You need
definitely.
not to mention a definitive management plan unless it is mentioned in the task.
Exactly, yes.
Mhm.
Okay, your scenario, Dr. Abdullah. Yeah, yeah, your sound now very clear.
Very clear. Now.
Yeah, there was a problem. Okay, good to correct it. Mr. Hani, 65 years old, admitted to the emergency, shocked. His ECG showed evidence of extensive MI. He was transferred to the ICU and was given streptokinase. His consciousness was progressive worse, so the CT was done revealed extensive intracranial hemorrhage. He is in the ICU on mechanical ventilation. Your task discussed his condition with the son, Mr. Rami, about his father condition and manage the concern. I will give you 2 minutes to prepare yourself. Okay, Dr. Sarah also wrote good idea to mention. I believe that your mother is aware about our meeting. Yeah, this is one of the good solution to start with as introduction. It's a matter of confidentiality, just to show the examiner that you are taking care of the confidentiality because you are talking to another person. You have to confirm that you have the approval or the permission, or you are taking care of the confidentiality of the patient. That's why I mentioned it to you. Okay, so don't ask her, just assume it. Or as Dr. Sarah said, I believe this meeting, your mother aware about it. Okay, try to train yourself also about the jargons. Make the words very simple while you're talking. And if you talk in medical way, you can explain it instantly whenever the word is or the term. Like as Dr. Abdullah said, the multidisciplinary team, you can say multidisciplinary team, you can say it, no problem. But follow it with the explanation. Multidisciplinary team means group of doctors. They are professional, they are experts, and they are the best in the specialty or the area they are treating with, like that. But don't say it without explanation. Or you can say it in simple way. Group, I will call group of doctor to manage your mother condition, to follow your mother, and so on. You can also provide at the end leaflet brochure website about the medication and the gastritis, about also osteoporosis, anything mentioned in the scenario, you can give a leaflet about it. Okay, just to give him more information about the condition or about the finding, about the medication. It's like that, okay?
If he asks Dr. Basim about when alendronate will return, I will tell him
Yes,
according to the decision of Boon Doctor.
excellent. Yes,
Okay, thank you.
it will be reviewed again,
Mm.
and it will be assessed by the doctors according to the mother condition and the stomach condition. Whenever they are thinking or they are assessing that your mother is suitable, they will do. I don't know exactly when it will be, but according to their decision. Always be diplomatic rather than being more clear or giving sharp cut of time or indication. Be always like diplomatic in your answer. Okay. If he asks about duration, don't tell after 1 week we can resume. How you can judge that after 1 week his mother will be fine and you can start the medication? So the best way, whenever your mother is okay, we can resume the medication. Whenever your mother is stable, we can let her go home. So this is the way how to answer about when as a question. When as a question is tricky one. Yeah, there is some clinical judgment, but also there is some current condition and some situation you have to take care of them. Dr. Abdullah, you ready?
Yes.
Yes, let's start. Here you go.
Hello there.
Hello, Doctor.
Yeah. I'm Dr. Ahmed, doctor in clinic today. Am I talking to Mr. Rami, son of Mr. Hani, 65 years old?
Yes, Doctor. I am Mr. Rami.
Yeah. Mr. Rami, today we are here to discuss some issues related to your father health condition. Is that okay with you?
Okay, no problem. Thank
Yeah,
you,
Mr.
Doctor.
Rami, are you the next of kin for Mr. Han? Am I right?
Yes, sure, Doctor.
And before to start and to be on the same page, can you tell me how much you know about your father health condition so far?
Doctor, I am a businessman and I was traveling last week in business trip. When I came today at the morning, I know that they told me that my father in hospital. I don't know why. Could you tell me more? Why? Or what is the condition of my father?
Yeah. Okay, Mr. Hani. Do you have any expectations? What could be wrong with your father?
No, doctor. My father daily exercise. He was well built. I don't know why in hospital.
Mm. Yes, Mr. Rami. Yes, your father is brought to the hospital in a condition with low blood pressure, and he was having some troubles with heart condition. And I'm sorry to tell you that uh, his condition was unstable, and it did for him tracing for the heart, and it showed he has an extensive myocardial infarction. I'm sorry to tell you.
Oh, doctor, how can that? My father was daily exercise. How come he never has any disease, any diabetes, any heart problem, any fats? No problem about my father. So,
Yeah, Mr. Rami. Yeah, I'm sorry to tell you about this condition, about this bad news. But be sure we are here to support your father and to give you support and to help. And if you let me, I can explain to you about this condition.
okay, please, doctor, please.
Okay. Do you heard about myocardial infarction?
Yes, yes.
Oh,
My grandfather died due to heart problem, and my uncle last month also has a cardiac problem, heart problem. But my father, why? Please
um,
explain to me.
yes, I'm so sorry for what happened for your grandfather and your uncle. Yes, and I can explain to you briefly that his heart is affected by a block in one of the blood channels supply the heart, which lead to affection or the loss of tissues of the muscle of the heart. I can draw to you simply. The heart is composed of a large muscle. When there is cut in the blood supply of the part of this muscle, are you following me, Mr.
Yeah,
Rami?
yes. Please
When there
continue,
is
doctor.
cut of blood supply, this affects the function of the heart, and it will lose this area of supplied by this blood channel, which is blood. Okay, and also I want to explain to you more what happened in the management. Once we diagnosed this myocardial infarction, he shifted to the intensive care unit for treatment. And in such condition, we gave medicine called streptokinase, which is a clot dissolving agent. Are you following me, Mr. Rami?
Yes, doctor. I'm with you.
Help in dissolving this clot, and he receives this medicine. But Mr. Rami, unfortunately, and I'm sorry to tell you about that, he developed his awareness level is decreased, and we shifted him to do a scan for his brain, and it revealed he has bleeding inside his brain. I'm sorry about that bad news again.
What you say, doctor? My father has heart attack and has bleeding in the brain.
Yes.
And the drug is this medicine is cause this bleeding. Oh, doctor,
Mr. I,
who give you the permission to start this medication?
I understand from where you come, and I'm sorry for your father, but be sure this medicine is given for your father for his best of interest, and it is the suitable choice in his condition. and this decision is made by the consultant, and also your father accept this uh, this medicine to be given for him, and what happened for your father, I mean the bleeding, is one of the known drawbacks of this medicine. Are you
Okay,
getting my
doctor.
point,
Yes,
Mr.?
yes, I get your point. But why anyone didn't call me? My name in my number in the file, and he can call me and told me that we are going to give your father some drug like that. Why didn't anyone call me?
Yeah, I appreciate this concern, Mr. Rami, but your father at that time, he was uh, aware, and he is the one has the right to decide about taking this medicine. I hope you understand my point.
Doctor, you told me that my father was disturbed and shocked during admission.
Uh, Even so, Mr. Rami, uh, this was revealed from the progression notes, but I need to check again about that. But be sure, once this condition happened, the decision, once the patient is unaware, the decision will be made by the team or by the medical team in the best of interest of the patient. How do you feel about that?
Yeah, doctor, I feel upset about that. I feel there is a mistake happened to my father, and there is some negligence.
Mhm.
2 minutes left.
Mhm. Yeah, Mr. Rami, I understand your worries, but be sure what happened for your father is one of the known drawbacks, I mean, side effects of this medicine. And uh, I'm not here to defend about the team, but I just want to explain to you it is one of the side effects of this medicine, and your father is managed in a proper way that he shifted to the intensive care unit, and they did for him the CT brain, and even they for support of his condition connected to a machine, a breathing machine, to help in the regard of breathing issue.
Doctor, okay, doctor. Why my uncle last month have it is named the catheter to the heart. Why didn't and now he's okay, very good.
Mhm.
Why my father didn't have this catheter and have this bad drug?
Mhm. Okay, I understand your question. With this regard, the options of treatment, which is availability in the center, okay, and this also depends on the time when the patient he present to the hospital. So this medicine given in his best of interest, maybe the availability of the medicine, and also this catheter will be done for your father, but this will be done after they assess after after receiving this medicine. I hope you get my point.
Yes, I got my point, doctor. What is the situation now, doctor? Please.
Yeah, now your father in the intensive care unit, he is connected to the supportive machine to support his breathing. He will be managed by a group of specialists, including the brain doctor, the heart doctor, and also the blood doctor. And mm, he will be kept on under the eyes and monitoring.
Okay, doctor.
Okay?
Okay, I told you I feel upset. I need to refer my father to any hospital, to other hospital. Can he
Mm.
refer? Can you refer him to other hospital?
Mr. Rami, I'm so sorry for what happened for your father, but be sure we are here to support him and to give you full support also. Regarding repair, your father condition now is not stable, and even he will, uh, if you refer to any other hospital, the care will be the same. and the management plan will be the same. But I'm afraid to tell you that his condition now is not stable to be referred, and he will be at risk of some complications.
Okay,
Thank you,
thanks.
Dr. Thank you.
Yeah.
Very good,
Thank
Dr. Abdullah. MashaAllah.
Start a comment, please, Dr.
Okay, but very good, mashallah. But there is a point of the conscious that when I told you why didn't anyone called me, we say that this urgent situation and the time here is very important, and we can't judge what is happening that time. We can go back to the receptionist. They have the record and the time of calls. I can't judge what happened. Other than everything is good, but there is a late. The evidence of intracranial hemorrhage are very late. I am meeting him early, but it is very late. But very good, mashallah, Dr. Abdullah. Very good. Thank you.
Thank you.
تفضل
Okay,
دكتور باسم.
thank you, Dr. Mahmoud. Yes, thank you for the scenario. Well done, Dr. Abdullah. Yeah, some comments. I hope you can accept. Regarding the diagnosis, you said extensive myocardial infarction, which is, I guess, major jargon. And Dr. Mahmoud, in between, he corrected you. He said, "Oh my God, oh my God, my father had heart attack," and now you said bleeding in his brain.
Yes. Forget. Yes.
Yeah. So the best term is extensive or
heart attack.
Yes. Yeah. Yeah. So your father came with us with, I'm so sorry to say, in very bad condition and in very critical situation. And the blood tests and the workup, the scans showed something we didn't expect. Oh, doctor, what you mean? What happened to my father? Please, doctor, tell me what happened. You can say now the breaking bad news. He had a massive or a big or eventful heart attack. Oh my
Dr.
God.
Basim, I need to mention it in terms, then I can.
But you didn't explain. Yes, you said, but you didn't explain. That's why I'm correcting you. Right?
Yes, I
You said,
mean,
yeah, you
there
said
is
major.
blood in the blood
Exactly.
channel lead to affect large area of the heart.
I mean, while saying or breaking bad news, you have to do it in non-jargon way. You made it in medical way, but later on you explain, but not immediately, right? Yeah. So the best thing to make the breaking bad news as non-jargon, then you will explain it more as also non-jargon way, because also heart attack, what you can explain it in the drawback of the heart attack, as you said. It's a big blood clot and blood channel of the heart. This lead to death of some of the parts or the muscle of the heart. Simply. For that, we immediately admitted him and we give him some medication in the best interest of his condition. You have to mention this word. Best interest for any medication means it's life-saving medication. Whatever the side effect and the drawbacks, it was life-saving medication, which is best interest of his condition. So we give him, this is the consequence of the case. He came with heart attack. We give him medication in the best interest. However, later on, something happened which is also concern or something we don't hope or we didn't expect. What, doctor, again, tell me, is there anything else? How is my father? Yeah, unfortunately, he had bleeding because of this medication. However, it was given in the best interest. How it happened, this is how, and why you didn't talk to me, why you didn't call me. I'm so sorry. The things happened, and we had to interact immediately. Your father was in critical situation that we couldn't do that. We couldn't call you. We have to interfere. And he was in very critical situation that necessitated us to interfere with as the best interest of his condition. So, doctor, what you'll do now, you can again explain he is on the ICU. It's a critical care unit, which is some patient in like your father condition will be stayed there, taking care, our eyes on him, following him, observing him, and unfortunately he's in unawareness issue or an awareness state that we are necessitated to connect him to a machine called mechanical ventilation, and this machine will be supported his breathing as long as he is in this state. I'm so sorry to be delivering all this news today, to share with you all this bad news. Are you okay? You can offer always support between every event because you have three like breaking bad news in this scenario: heart attack and ICH and the coma and connection to mechanical ventilation. The continuity of care is very important, and the reassurance that we are here to support, to do our best, everything with him. However, if he asks you what the future plan and what will happen, we don't know. We are here to take care, and we will update you about the event from time to time, and you can give him leaflet brochure about the MI, heart attack, and about the ICH and the coma state, which is the patient in right now. This is how to do it. It's full scenario of breaking bad news. Of course, explanation of disease, which is heart attack and ICH, side effect of medication. And if he blame you, you can say, as you said, this is side effect, drawback, unwanted effects, and it might happen. And it happened to your father. I'm so sorry for that, and so on. I want to take my father to any other hospital. I appreciate your worry about your father, your care. However, as you said, his condition is not suitable. Don't assume that the other hospital doesn't have the same thing we are providing. Don't say that. This is in real life. We are saying that. But in the exam, this is family request. Whatever he wants, let him go, okay. But if his father is stable, I will not blame other hospital that they don't have, or I will not assume that the other hospital doesn't have what we are offering here, or they will not provide something more than we are offering here. No, it's not in the PACES life. It's in the real life, yes, but it's not in the PACES exam. They might comment you on you why you assume that, why you said the other hospital will not provide something which is not present in your hospital. They might have, for example, neurosurgery, and you should do that. But the best answer, your father now in critical situation, and I'm afraid he is not suitable to be shifted or transferred or moved to another hospital. However, anytime his condition improved and he can do or he can go, we can help you in this. Because always the family has the right to either withdraw or to take the patient or whatever. It's autonomy. And now the patient lost the autonomy, now with his son. By the way, one of the important point here, the advance directive, does he give or express any wishes in his life? You don't know. He might awake or no. He might die soon or no. So this is one of the points you have to explore it if you have time, because this scenario is very big. But if you have time at the end, you can do this. Ask for advance directive, and any patient or any person who nominated to take decision on behalf of him, and the support who's dependent on him, and does he need or anyone of your family member need help, we can offer them. Okay, this is the scenario, but in general you did it well. Just a complimentary comment I made. Okay, any other question for this scenario, or any question for this scenario or previous scenario, or the two scenarios we did earlier? Any comment?
Basim regards the point of advanced directive and RPA. In a
Yeah.
cruise situation, this would be controversial.
Yes, it's
Yeah.
controversial. Yes, no problem. But
So,
whenever,
so
yeah,
if I'm in the exam and even I have a time, I will not mention really, because the extent of the disease, and you get my, if I can clear for you, I can explain in a clear way. When they want you to mention AD or LBA, they will mention his terminal is like that, his condition is not stable, he has. But in this scenario, they just mentioned the progression is like he has ICH. And in
okay. And in the real life, as you said, patient has MI and complicated by coma or ICH and lead to coma, which necessitate ventilator. What do you think the patient's mortality or prognosis? I'm not also judging that you are also wrong. No, my opinion, anything.
no, it's not about
No,
wrong or right. But
yes,
I
yes.
know
I'm trying to
even
make it yes clear.
for the basis affairs and like that, this controversial and most of
Yes, yes,
tutors, they it's better not to mention in acute situation. Okay. And especially in this scenario, as you mentioned, there is a lot of tasks. If it is calibered as to mention, it will have low mark. You get my point? And if it is not to mention and I mention it, it may affect my score. So in like this scenario, I will not go to mention it.
yeah. You're correct in everything, but you told me something. This is make me argue with you. You said even if I have time, I will not talk about it. It's up to you at first and at the last. It's up to you if you want and you have time. If you want to explore it or no, this is up to you. But my point, if you have time, this is my opinion. Because I know this scenario is rich of information. But if you have time, why not to ask it? Patient in coma, and he might need also to be nominated for someone to take the decision in case of he didn't wake up. So why not to offer it? Anyway, it's up to everyone. I'm not saying this opinion should be applied, but if you have time. But if you don't have time, of course, the priority always to the scenario task. What I mentioned earlier, very important, the ventilator, the coma, and the ICH, the MI. Of course, difficult to have time to ask about it, but sometimes you are finishing before the time and you don't know what to say. The rule here, whenever
Is
the
it?
patient condition is progressive and worsening,
Mhm.
and he is in coma connected to ventilator, you don't know what will happen further. He might wake up or no. That's why if you have time, you can touch it quickly, not in details. This is my opinion again, and it's up to everyone to follow or
No, no.
no. Yeah.
I mean, Dr. Basim,
Mhm.
there is some scenarios even from outside we can assume that the prognosis here is poor. Yeah, I mean, I faced one scenario: patient has cancer, and they did CT and it shows there is a mass possibility of MITS.
Yes, yes.
Point. And in the scenario, they did the CT brain and to explain to him.
Mhm.
When we discussed this with this scenario, they said, okay, the best image to diagnose the receptibility of the myth is the MRI. It was not CT. So I couldn't judge in this way to say for the patient to ask him about AD and LBA because he has myths.
Yes, but it's still uncertainty. You don't have proof, right?
Yeah, but also from outside, he's a cancer patient. He has possibility of myths. He has drop in his GCS like that. You get, but because why they judge about that? Because this acute situation. When they said if the patient is terminal, he has chronic problem, he has long-standing problem. Okay, this would be the suitable way. And even in the scenarios they will mention for you, he's more deteriorating. I just I mean, yeah, yeah, we want help to clarify this because
Yes,
uh,
yes.
thank-
Yeah, thank you, Dr. Abdullah. I got your point. So if you have time, I don't know if you can mention it, especially if written in the scenario. But by the way, they are not writing such issue in the scenario. I mean, for the advanced directive or lasting power fatal, they are not writing, please talk and address it. So it's one of the hidden points or hidden agenda in different scenario, and it's varied from scenario to scenario. So
Mm.
most of the progressive disease and terminal, as Dr. Abdullah said, yes, you have to offer it. But for me, if a patient admitted to ICU and he's in coma, I will do it. Also, again, I'm insisting on my opinion, but it's okay if your this opinion is different. We can hear from others. It can.
Yes, I think you are right, Dr. Bassem, because I failed this station because maybe I didn't say this. This was the scenario. My station was the scenario that one patient has pancreatic cancer with metastasis, and
Mhm,
they told him, the doctor, that he's on palliative care for 1 month, and he
mhm,
died. So he was coming to his main concern to complain about the GP because he didn't detect this cancer earlier. So
mhm,
I addressed his concern and I asked him about support and everything, but I didn't
mhm.
talk about the advance directive or any wish, and I failed this station. So I think this is the cause.
So you didn't ask about LPA? You didn't.
No, I didn't ask about this.
Okay.
On palliative care for 1 month, he told me anyway I will die after 1 month. So I should ask him, do you have any wishes or anything? But
Yes, but
that's
yeah,
why I
this.
think this
Yeah.
is only because I approached the station well and I was with the patient, but I failed this station. I don't know what is the cause. I think this is the only cause that I didn't talk about the advanced.
Yeah. But this is going with Dr. Abdullah also that like this is terminal patient. However, he is not yet terminal as final decision. Yes. For me, any patient deteriorating or condition is worsening, admitted to ICU or metastasis or on ventilator, all these things make the lasting power of attorney and advanced directive. Um, to ask it is, I guess it's something makes sense. So better
Yes,
to ask it. Yeah. And please, Dr. Sarah, whenever you have the comments, you can share it with us to be more aware about the exam
yes,
situation and the comments. Okay.
yes,
Thank you. Thank you for sharing this with us. And thank you for the comment. And Dr. Abdullah, practice, Dr. Mahmoud. I guess we have long time today. Any question or comment before ending the session? Okay, thank you, Dr. Abdullah. Thank you, Dr. Sarah and Dr. Mahmoud and everyone shared with us this session. Have a nice weekend. We'll see you, inshallah, after tomorrow. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.